benefits, but also restorative justice. And so that is trying to rebuild individuals so they are in a better place than when we had the opportunity to meet them. And again, there are few people, and I've had the pleasure of knowing the pastor for many, many years. In fact, I was going through my phone looking at old pictures. Reverend Clayton still looks good. On the other hand, I've gone completely gray. But I looked at pictures from years ago. But it's really special to me to meet someone who walks this message with integrity, with compassion, and with vision. And what's so important, in fact, the World Day of Peace is going to come up on September, and we're going to have a World Day of Prayer, and we're going to call upon our faith-based leaders. But the people in this room are transformative. The people in this room give a darn about those on the margins, whether it's the poor, the broken, the addicted, the imprisoned, the veteran returning home. So it's about us constantly doing outreach and bringing a message of compassion and caring to our community, to our state, and to our nation. And a man who does that so incredibly well, with great integrity and heart and passion. Someone who preaches that both by his life, by his doings, and his words. I'd like to call upon Reverend Kenneth Clinton.
May we bow our heads together. God, our Father, we are thankful and grateful to you for this day and the privilege we have to come together as people from across our state to empower ourselves and inform ourselves as we can help people better. Thank you for the privilege to be helpers, healers, and transformers. In Christ's name we pray. Amen.
Thank you, Pastor. And again, I just want to say thank you so much for the pastor for being here. Now we'll just talk a little bit about the matter at hand. The matter at hand is one of the most important issues, and I'll call upon our welcome address and our keynote speaker. We're really honored to have Senator Mukherjee, but this was a bill that was passed by the federal administration. And just so that you know, it's estimated by the Department of Human Services in the state of New Jersey that upwards of 47,000 people in the state could lose SNAP monthly. And that is happening right now. And by the way, in terms of NJRC grapples that with on a daily basis, and you're going to hear from the panelists, people like Frank Mausden, people like Damon Watson, you're going to hear about what we have to do. In January, Medicaid will also be bound, most polite verb I could think, by HR 1. And so why that is so important is it's expected that upwards of 337,000 New Jerseyans will lose Medicaid. 337,000. That was the original projection by the Department of Human Services. So the purpose of the conference here today is, and I see my dear friend Josie, and I see some folks from NJRC and Rob Parkinson, is to talk about what is HR 1. I'm not being political, but I can't call it by the name that others have called it, the big, beautiful blank, blank, blank. So we'll call it HR 1. But what it basically is if it's a restricted covenant both on providing SNAP, food stamps, and Medicaid. And this is going to have a pernicious impact because so much of this is not only certifying what constitutes an exemption, and we'll talk about that, but what are the work study, work, or community engagement obligations for the 80 hours, both for Medicaid every 6 months and ongoing, and for SNAP. And we'll also share with you what NJRC is doing. And our goal is you're free to copy everything we have, because our goal is to make sure that as many New Jerseyans eat, as many as New Jerseyans provide health care, and understand on the outset, this applies to the population, not the entirety of the Medicaid population. For the population which, ironically, pursuant to President Obama's leadership in the Affordable Care Act, the expanded able-bodied. And so I just want you to be mindful and focused. These are many individuals that are returning from prison or jail or addiction treatment, or veterans that don't qualify for whatever reason for VA health benefits. For example, 83% of the veterans we serve in New Jersey that Sharon serves are individuals that are other than honorable. So they're all impacted by Medicaid. And just as an aside, unless you have 100% disability from the VA, you're going to be subject to the conditions of HR 1. So today's topic and today's focus is to orient us. What is HR 1? 2, what constitutes a satisfactory fulfillment of the obligations of HR 1? And 3, questions going forward and how we can address this. And so it's our great honor to say, in terms of a champion of Jersey City, a champion of the things we believe in, there are few people who have articulated and presided such a passion for change and for healthy change. And I can think of bills, whether it's on enrolling people on Medicaid with Senator Cunningham, or providing opportunities for workforce development, or providing for social justice as our welcoming speaker. And I will tell you, he champions those that are on the margins. He truly believes this. And he's a successful businessman. He's a leader in the community, and he's a dear friend and a lawyer, and he just got this fancy public policy degree at Princeton, right? And so I'm saying to the senator, I'm like, why are you going back and getting this degree at Princeton? I mean, it's a little pushy, but it's okay. And he said to me, he goes, Jim, I just want to learn how to do things better and lasting change, systemic change. And that's the type of person he is. He takes up his time, and he married way up, has 2 beautiful children. Ladies and gentlemen, can we have a warm round of applause for Senator Roger Pershing? Come on, we can do it better. These guys are a champion.
Thank you, Governor. Thank you. It's always a privilege to be here in Kearney, to be at NJRC, and to witness firsthand all of the incredible God's work that so many of you are part of. But it's not good to be here today because HR 1 is a complete disaster. And we're just planning for it now. And I'm encouraged that there's so much interest in bracing for the impact on our state and on our most vulnerable communities. But I have a lot of fear about the time coming when we truly start to feel the impacts. You think this state budget negotiation was bad? Wait till next June and wait till the upcoming fiscal. Talk a little bit about SNAP and Medicaid. And then we'll get into why this day is so important. I'll try, despite my natural inclination, as the governor will tell you, I'll try to avoid getting into the discussion about the technical aspects of HR 1 and all of the things that we could do, because you'll have panels and people much smarter than me and to talk about that throughout the day. I'm tasked with setting the stage for the day. So SNAP and Medicaid are there to prevent, to make sure an empty refrigerator doesn't become a health crisis, that your prescription is filled before a medical condition gets worse, that a screening happens before a diagnosis comes too late. They serve as the baseline of some of the needs of making human beings feel dignified so that they can go out and get work and be economic contributors to our society, which ostensibly was the rationale behind those who championed HR 1, like our president. And what it misses, and this is true for the reentering population, this is true for the public at large, is that the most expensive person in America is not someone on government assistance, on food stamps, on subsidized healthcare, or even living in subsidized housing. the most expensive person in America is the person cycling in and out of the ER because they don't have access to coverage. So charity care is paying for them. It's the person in and out of homeless shelters. It is the person recidivating and being forced back into the criminal justice system because we didn't invest a fraction of the cost of incarceration to keep them out of the system by providing the help when they most desperately needed it. So to use, I think, elevated legal vernacular, HR 1 is ass backwards. And I think we should start there. I'll tell you a little personal story. So, you know, people are always, oh, my parents immigrated. I immigrated with $20 in my pocket and a shirt on my back, $100, whatever your family anecdote is. In my case, there's two different versions of the story. I had occasionally told my late father, may he rest in peace, he's hanging out with my favorite drill instructor, Jack McGreevy, up above. But my father used to tell us, I've heard him tell the story with $60. I've heard him tell the story with $80. So I went on AI recently and did the adjustment for inflation. And the $60 version of the story is $500 plus today. And the $80 version of the story is $688. So we're talking about $500, $700 adjusted for inflation. He actually did immigrate the early 1970s with a suitcase and $60 or $80, depending on the version of the story. And he came to grad school. He went to St. John's. That's why he and Speaker Coughlin always, I think, got along as St. John's fans. And he was an accountant. He was a CPA. He did everything right, I think, in terms of working hard as an immigrant, supporting his three boys as the youngest of three, and a late surprise. And he had a pituitary tumor, and he needed steroids for his glands to function after the tumor. And then other stuff came up, osteoporosis, central nervous system pain, and all this other stuff. And he had a couple of strokes as a result of some of these other debilitating illnesses. So when I was a freshman in high school, after the second stroke, the doctor said, you can't work anymore. But he wasn't old enough for Medicare. This is the pre-ACA days. I didn't yet meet eligibility for SSDI, but he couldn't work anymore because of his health, according to the doctor's advice. But he couldn't afford health coverage without his job in the catch-22 that is a first-world democracy without health care for every American. So they had to return to their native India, you know, where they had immigrated decades before, to have access to health care. So he wouldn't have been able to meet the 80-hour work requirement for Medicaid. I got emancipated as a minor, had to stay back, and dropped out of high school after 15, so he could talk about my, and he could make fun of my Ivy League master's degrees when he has two of his own. But although I went to college and grad school again and law school, I still don't have a high school diploma to this day because I had to drop out so I could support myself and work full time through all of those higher ed pursuits. And I was deprived of years of my later adolescence without having my parents in the country until I was able to bring them back a few years later, because in this first world democracy, he didn't have health care. Now, when you are re-entering and you don't have access to health care, you're deprived of Medicaid, and you wonder if you were better off inside if you were suffering from debilitating illnesses. What have we become as a society? By the way, veterans are no longer part of the automatically exempt population unless you have 100% disability rating. I have friends, colleagues that I served with in the Marine Corps at 60, 80% that have occasionally been in a bad way. NJRC has worked with countless folks, including people I've met with who suffered from post-traumatic stress and other concurring diagnoses. Substance use disorder, which is in the DSM-5. It is also a mental illness. It is a sickness that we need to help people out of. And the stakes are especially high when you're returning home from incarceration. You know, people experiencing homelessness are no longer automatically exempt, right? And we're talking about hundreds of thousands are projected, 300,000 New Jerseyans, just New Jerseyans, projected to lose family care, not even because they're not working. This is just the number of people.
Is time serving your time, paying your debt to society and treating you. So I think every public policy decision we make can be guided by this. People do better when we give them a fair chance. Work is not just a thing. It is dignity, it's stability, it is redemption. So purpose. And if someone's just starting to plan that, that is not serving the goals of the folks who said we needed to pass the job. The income of the department for adults receiving SNAP and Medicaid, if you are able-bodied, truly able, and are able-bodied, and able to secure full-time work. That doesn't sound scary. I mean, we have every 7 hours. We can't. So my staffers. Not so good. When we're in the process of looking. Now, thankfully, job training and the process of being engaged in your community can help us prepare for HR. They may be trying to hurt vulnerable community. We all know. This is in President of the United States, there was no, and the folks who want to punish communities of color. They want to punish blue states. They want to punish earth communities. They want to punish communities. So we actually have tools to fight back. Documentation, verification, workforce training.
When you're looking at that, I'm looking for
And all of the things that
This is all taken out.
those tools, people are going to suffer. But there are tools at our disposal and frameworks within the law that we can use to make the number of folks can go into the system a lower. And that is what this day is about fighting. This day is about fighting back within the framework that we are stuck with. And then outside of this room, and I know many of you will stand with me because many
Oh, we gotta keep a certain.
outside of this room, we will continue to fight that.
So what's the difference?
At the state level, I reject the notion that I can't do it.
You got your rules, right? It's different, you know, it's got to be- Why they go- It's got to flip it down now.
Show me your budget. And I'm gonna tell you that is the statement of your dollar. In the state budget, there are things that we can do to prioritize, reallocate, to try to stymie the effects of the and then, right. And then we will continue to fight in Washington and God will take back. We have some of that. Everybody else that is in line with this one and we will get them up to see. In the meantime, we can fight back within the framework. And that's what you will be talking about today. That's what this conference is about. Thank you for getting the work. Thank you for taking the time. Thank you for carrying. And I know that you will be to reduce the number of signatures. Thanks, God.
Senator Percy just introduced legislation on veteran sports, so we just have a little present.
I just want to say just a couple words. With sincere gratitude for your steadfast dedication to all our veterans and to those rebuilding their lives through reentry. Founded in Ireland in 1857, following the Great Famine, the League was created to restore hope, dignity, and opportunity to struggling communities. Its enduring beauty has come to symbolize resilience, renewal, and the belief that lives can be restored. May this belief serve as a small token of appreciation for your leadership and your commitment to helping others find hope and new beginnings.
I want to start with a talking about the town elegant. And Reverend Boyer, that's the original Reverend Boyer, Vietnam veteran. Give it up, the Reverend Boyer. You are the first lady. All right, so we're going to get started, and I ask our first panel to come on, and I'm going to ask us all to flip to the first page. And I'd ask all the panels from the first page, from the first panel to come forward. And can we have a big round of applause for Senator Raj Mukherjee? Come on, because Senator Mukherjee, we need champions. And he's our champion. So on the first page, you'll see it's on page 3, the basics. And we're going to start with this, and we're going to go through it, and you're going to see, we'll follow the program, overview what it is, why it matters, exemptions with Madison, understanding the eligibility, and what counts towards the 80 hours. So we're just going to go through this quickly, and I'd be remiss if I didn't also thank Lacey and Francis, our chief of staff. Lacey. And the Assistant Commissioner of the Department of Human Services, our dear friend, the great Valerie Melty. Thank you, Commissioner. So, all right. So on July 4th, 2025, everybody with me on page 3. All right, you'll see the Medicaid and family care community engagement. So I just want to be clear, it requires those adults 19 through 64 that enrolled in Medicaid through the Affordable Care Act. What was the Affordable Care Act? The Affordable Care Act, which some call the Obamacare, the purpose of which was to expand health insurance in this nation, is to demonstrate at least 80 hours per month for work, education, job training. The reality is that becomes 80 hours every 6 months. That is which the CMS, which oversees Medicaid, will audit. So approximately every 6 months, there will be this requirement to fulfill the 80 hours. Again, the 80 hours is work, job training, or community service. Work, job training, or community service. NJRC will provide workforce training, not work. That's the public. Will also link people to community service. The law requires expansion adults to reduce them on the second paragraph every 6 months instead of annually. So that's important. Every 6 months, you're going to have to renew your eligibility for Medicaid. State officials project as many as 300,000 to lose NJ family care. Number 2, SNAP. Now remember, Medicaid is governed by the Department of Human Services. And I'd like from my heart to say thank you to the Cheryl administration, thank you particularly to the governor, thank you to the Commissioner Shaw, thank you to the Assistant Commissioner. Just moved your seat. It's like all of a sudden, you get over 60, somebody doesn't. But it is so incredibly important to understand partners. And so we've got great partners with the Department of Human Services, but what's also important is partners with the county. And that's why I'm so glad that my dear friend, Frank Mazza, who's just sitting over there, wants to work too. He what? He got a call. All right, at least I'm noticing, I'm still awake. But that's why this is so important. So we're going to start going through this now, and then we're going to follow the agenda. The first thing we have to understand is that there's 2 agencies. There's Medicaid, which is governed by the Department of Human Services and overseen federally by something called CMS on the federal level. SNAP is governed by the Department of Agriculture. All right? So as Senator McCurdy said, HR 1 is a federal legislation affecting both Medicaid and SNAP. You have to understand what Medicaid and SNAP are also promulgated on the local levels by the Board of Social Services. You need to understand that also there may be occasional monitorings or audits by CMS on the state level. When people talk about upwards of 337,000 people being lost from the Medicaid roll, is because people are going to be required to document their performance. So now I just wanted to say, Gabby, why is this so important?
You ain't do it on Friday, man? Might think about it. Thank you. There's applicants around it, man. You got to be home. You got to be here. This money hijacked the box. No, I'm back here.
We estimate roughly 200 billion. Higher eligibility, expanded work requirements, and limits on benefits calculation updates. So
these people that seek it.
we have to emphasize how important this is and the work requirements, because this is safeguarding elected purposes.
Right, so Jenny, tell me on the local level. What is this meeting you? Jenny, can you oversee or not site? Jenny, what is so? You just want to close this meeting.
Good morning, everyone. It's important to me to the clients.
Close this meeting.
So it really concerns me. But also give us guidance on.
But we're seeing people right now lose SNAP. But Sharon, can you just jump in and then let's.
What? Be alive.
Right now, we're seeing people drop.
Yeah, I'm not.
Yesterday, he's lost his SNAP. We have enough of the staff reporting 70% service. He cannot work. Now he's hungry. He asked me if I could try to somebody please help him.
So this is real. This is real. Taking a veteran with 70% disability. Nothing is changed so that he can eat and not off the SNAP. So the first point that we want to make is, and when we're designing today's program, we're very intentional. Why this matters? This is not an academic exercise. This is reality. So Liz, can you just see why this matters across NJRC and what is this doing to NJRC products? And you got to hold the real close.
It matters.
Oh, no.
Service across all cities and taking care of other people.
And why is this, Sharon, why is this so hard on the documentation for our clients?
Right, so many of the people that are losing SNAP are eligible for SNAP.
This is important,
But
this is important.
the documentation and paperwork requirements are over the top. So it's difficult for them to figure out the documentation, difficult for also the providers to know what forms to fill out for our clients and for our veterans. So, people should not become unable to get food because they can't figure out the paperwork. And that's the problem.
So what is the NJRC doing to get that paperwork to help if we're losing SNAP?
Well, we're working with social services and we're figuring out what each client needs that are being denied or being, so we're going one by one and going with them to the doctor, getting the correct exemption form, going with them, figuring out work eligibility, what we can do to help them, volunteer opportunities, but it's really step by step, it's boots on the ground to help each person.
And so Jenny, when you see people losing SNAP, what's happening on the county level? And what are you doing at the county to try to help them to get their SNAP back?
Well, like Sharon just mentioned.
You're supposed to keep closer there.
So like Sharon just mentioned. So when they come out of county level, tell us that they are, the issue that I'm seeing right now, I'm working with that. We're not being provided the right documentation. And so what they do is they're constantly trying to educate exactly step by step what they will need to do to get them reinstated back into it and then further along. So right now, what we do is we provide them with the accurate documentation, we contact at county level, we request that the correct documentation, so that they're apply.
That's great. And so what is NJRC doing to help make sure that we provide the ability for people to get back onto SNAP?
So we are preparing with the 80-hour workforce readiness program. So our participants can qualify for PAT and when that comes through January.
So we're getting 80 hours, so when people come to NJRC, they have the 80 hours. And then are we gonna send a letter to the county, or how are we gonna certify that in the letter? So you've got Frank Mazda here, who's, a big shout, we love Frank. By the way, he's back here from his fancy phone call, I called you up before. But what are we gonna do is to make sure that people, the county knows that people have done.
So once the clients go through our workforce readiness program, focus on work readiness, doctor education, experience, when you say more, we also will notify the clients to share experience so they're not missing those important recertification.
Thank you. So now I want you to turn to page 4. And on the top of page 4, you will see the 80-hour standard. And this is what they're talking about. We're going to go into depth. Both programs, SNAP and Medicaid, this is as required by HR 1, uses the same monthly threshold. But again, for SNAP, it's a approximate, we need to understand the bigger burden. The way you can fulfill that for Medicaid, we're focusing on for a second, is work or training programs, education, and community service. And I just want to go through each one of them. Work, paid employment, including self-employment, under Medicaid monthly earnings of at least $580. That's 80 hours. Work or training program, participation in a qualifying employment training program. Like what happens here, you see men and women in these programs all throughout NJRC Training Center. These are all on the ETBL Department of Labor list. So again, that's a qualifier. Or enrollment, education, enrollment in education program, higher education. And lastly, community service. So I just want you to understand the 80-hour standard to be fulfilled by work, training programs, education, or community service. Everybody understand that? All right? And then we're going to later talk about compliance and attestation. You see under the heading, when compliance is checked. Medicaid, an application, new applicants must show compliance for at least a month. But most importantly, existing members must show compliance for 1 or more months between renewals and every 6 months for expansion adults. That's the adults we spoke about. And SNAP within the 3-month time limit. What happens on non-compliance with Medicaid, this is important. The state will first check its own data. This is why it's important to have these partnerships with the state. Remember, the state administers Medicaid for the federal government. The state will first check its own data, payroll and wage records, and Medicaid data before asking the member for anything. If the state cannot verify compliance, it must send a notice of non-compliance and give the person 30 calendar days to demonstrate compliance, right? So the state will be sending out a letter to Jim McGreevy saying, we think you no longer qualify for Medicaid. Then a person who's disenrolled cannot receive subsidized marketplace coverage, but they can reapply. So our whole goal is today is to make sure that the community, the nonprofit community, government, I know Director Mazza, I know Senator McCurdy knows the importance of the 80 hours. And to partner with NJRC, because at all of our sites, whether it's Hudson County, whether it's Newark, whether any of our sites, we will provide the program for 80 hours for workforce training. But we're also going to talk to you about how we're going to do community engagement. So lastly, Jenny, why is this so important? Okay, and how real is this crisis?
But I'm gonna take time to go and actually get drunk.
Please speak, let me speak.
She had lost her and she was pregnant a couple weeks. And I had to spend
Yeah.
Liz?
Yeah.
We're seeing the impact across all of our state and
This is really important. Exemptions are not done automatically. Go ahead.
while they're getting their paperwork together, and also some of them, they don't have addresses, they can't get mail, so they haven't gotten the notice that their benefits are turned off. So now, things that have only been pregnant without food, nutrition is for just those matters, it's truly important.
So, and this, I know that this sort of raise your awareness, Sharon, why is it so important to veterans, to people returning home from prison or addiction treatment?
Right, we can see that they're being tripped up by the paperwork, and so, and not understanding the protocol. So linking up the community so that we can all work together. We have the deputy commissioner here. We are so grateful. The social services, Middlesex social services are going to let us know when the 90 days are up prior so that we can get the paperwork in. Every step is very important. Articulating what we have to do next at that partnership is going to make all the difference in the world.
And I just want to pick up what Liz said. Liz said people aren't being notified, but Sharon said it's important to talk to your Board of Social Services and we hear from Director Mazza, who is not only a dear friend, but somebody who walks the walk. And the way I think it was this guy, Thomas. Both agree with that. Gab, why is this so important?
This is so important because we need to support people that are that are So if we have some type of government, regulations, we have to do that because we can.
Thank you. Thanks so much, Gabby. Thank you, Sharon. Thank you, Liz. Thank you, Jenny. Now we're going to be talking, where's the great Tatiana? Where's the great Madison? Matt, can you come up? Also, David, can you come up? And we're going to start talking about exemption. So first, the first goal is, thank you, is trying to get people exempted. Exemption. All right. Matt? All right, and Madison's gonna start.
Thank you. So, as the governor mentioned, exemptions and exceptions for the ADR work requirement is really important. Making sure that we are identifying the clients that are eligible for exemption and making sure that they have the appropriate documentation for that to put through with the board of health. So the primary exemptions are going to be medical, behavioral health, or so somebody that's medically certified as physically or mentally unfit for employment.
Everybody see this? If you can, I just want to make sure in the back. Okay. And if you want me to read each of these, or are you going to go through each?
Yeah, I'm gonna go.
All right, good.
Yeah, so we're talking about chronic health conditions, right? Post-traumatic stress disorder. So I'm not a physician, but an individual that has received a diagnosis of chronic condition typically understands their history or they know substances. So we just want to be able to ensure that as a provider of the agency,
You have the mark back there, right?
understand and identify that they have been diagnosed. Responsibility for a child, an individual that is pregnant, somebody that's responsible for an incapacitated person, or an area participant in a drug or alcohol treatment program. So just going to the board of health services and saying, I had a diagnosis of traumatic stress disorder, that's not necessarily going to guarantee the exemption, right? So it's really important that we are identifying the diagnosis and also making sure that we have the appropriate documentation to back that history of things. So some examples of perfect certification.
Madison's really smart. So I just want to go a little slower just for us. So this is these are examples, right? So these are exemptions from the 80 hours requirement. So it's medically certified as physically or mentally unfit, a parent of somebody responsible for a dependent child, right? For a young child, pregnancy, and basically Jenny talked about that, responsible for an incapacitated person or participant in a drug and alcohol treatment program. So these are the exemptions. Let me just say that again. Now, the hard part, which Madison's going to talk about next, is having documented exemptions. But what we want to say is, and this is important, before you start talking about the 80 hours, you have to see that if that person is exempted from the 80 hours. Obviously, if they're exempted from the 80 hours, you don't have to grapple with this obligation every 6 months, right? They're exempted. And if I can say candidly, our first obligation, in fact, our first moral obligation is to see if that person is exempted. That should be, and that's why we organize this. Somebody said to me, Jim, why didn't you talk about exemptions before we talk about these specifics? Because if the person is exempted, you're not going to be in HR1 quagmire for the duration. So that's why, again, medically certified as physically or mentally unfit, parent or member of household responsible for a dependent child, pregnant, responsible for an incapacitated person, and participant in a drug or alcohol treatment program. And now Madison's going to go, and by the way, all these slides are going to be on the NJRC website. Please use them, take them, distribute them. We want the public to be as informed as possible. So these are the exemptions, right? So the mother of a child should not be subject to the work requirements of HR1. But you're gonna have to demonstrate that. All right, so you have to be aware. Sorry.
So a mentally certified, physically or mentally unfit individual for employment. So we're talking about that one form. So this can be completed by a medical professional. So I've noticed recently, there's been an update. So when an individual is applying for SNAP benefit, at the very end, there's actually an opportunity for them to download the med one form, but they have to have that signed off by their physician, a psychologist, or an advanced practitioner. So it's really important to make sure that it's an appropriate provider that's filling this out, and they're basically listing this as a deferral for employment.
And if I could just, so this is like, right? But this is the world we're in, right? Because normally before people would self-attest, there was self-attestation. If I am suffering from muscular dystrophy, I could say that I'm suffering from muscular dystrophy and I could self-attest. Now CMS is saying no self-attestation. You can't say that I am X and that is sufficient, and God bless them. If they wanted to verify in the old days, you would say X and you could be subject to an audit and somebody could ask the documentation. Now they're saying to go, and I appreciate Madison's thoroughness and professionalism. Like, you know, what's an NED1 form? I still don't have my real ID. But anyway, but you have to get it from a medical professional. Now, the important thing here is not everybody's going to see a medical professional every month. So if you're talking about exemption, you have to say to your clientele as we do in reentry, if you're going to have a doctor's appointment or a nurse practitioner, you have to sincerely think about the Med 1 form for the exemption, right? Because you're not going to go and get your physical, get your annual checkup, go to the doctor, and then say, oh, I need to have my Med 1 form completed by a medical professional, trying to get the appointment that next week. That's not the real world. So one of the things that when we're pushed here today is to be aware of the exemptions, please. And you're free to contact Madison, who's an expert in this area, is to think of the importance of the Med 1 form when you're visiting your healthcare professional, to get that signed so that you're exempted.
And to that point too, you know, when we're talking about the SNAP and the Medicaid, there's going to be different systems that are going to need to be the verification uploaded, right? So we can't assume that just because somebody has uploaded their verification for SNAP, that's going to go through Medicaid. We want to make sure that we're, you know, looking at all the correct entities so we can upload it. So and then could be anyone that's responsible for a dependent child, so some appropriate documentation would just show that the child is an adult, and you know we are looking to folks that work right home, so we haven't been in directly in their household for that time, so they have but we just want to make sure that they have documentation, children, this can also be child care records, medical care records, rental.
Where do you leave off at? What do you gotta catch?
And then when Sharon was just requiring that documentation, when Madison, I remember was responsible for a dependent child, that requires documentation. This is friends and documentation day. And we need to be mindful, and just in terms of the community that I have the privilege of working for, when you're coming from prison, and you're on your way out, and DOT gives you X. I know so many guys that be there like, I'm just getting out of here. And if you're living in a shelter or grappling with housing, you don't have nice little put your documentation in. So that's why you as a provider need to understand whether it's enrollment records, medical care records, rental mortgages, please take this Madison slide, because people are gonna have to be aware. They can be exempted if they have a dependent child, but they're going to have to prove it. Saying it isn't going to be enough.
The next one would be for everything, right? So making sure the bills are there, caretaking for all our bills. So paperwork, work back, basically that. Again, this is gonna have to be approved for final, confirmation by the because I think that's a lot of work, right? So when you're just taking these papers, you have to show that, right? What am I gonna do?
Yeah, it's just been different. CMS and Medicaid and Human Services, I hear for Valerie, trying to figure out what they want to change it. It's changed over the year. It's like reading tea leaves. And so sometimes it's very difficult. So what Madison is presenting to you is what we consider, even in doing this program right here, we made changes forwardly. We made changes up to the second because there were different regulations coming forward. But I get it. I just want you to be aware is that more fact evidence that you act for an elderly parent. If you're taking care of an elderly parent, you're taking care of your mother, your aunt, your grandmother. You obviously can't go out and work 80 hours, but that's going to require documentation. And the last one is.
And that is for participants of the drug and alcohol treatment program, so that can be easily provided by the facility, they'll say how many hours they're participating, what days of the week, if it's an ILP, OP, support group, and that will suffice. And typically they'll also include the letter hours that you're given weekly and monthly.
So again, participant drug and alcohol.
Yeah, so what are we considering when we're supporting New Jersey reentry clients with this process, right? So, as the director of social work for NJRC, all of our social work. When they come to intake and biosocial assessment with our staff. So we're kind of already, pinpointing the areas that they might be eligible for exemption. So we can go ahead and start getting supporting by. And to the next point, so every time with their healthcare providers, you get that minimum. It's not already there. So we're all humans, right? But it's just to say that we really need to assist our clients in following up, making sure that, if they were supposed to get a provider, they make their appointment, maybe have them, they report, that you have appointment for us, if they have this really important documentation that you need for your benefits. We're given what's going on outside of these programs.
Right.
That's how we're going to get in to make sure that they have access to the care that they need and they can get supporting documentation.
All right, so again, I just want to go over this. The next line is healthcare provider complete that form that you said. Assist participants obtaining a compliance letter, IOP, that is very important. This is the documentation game. Every time you see someone, documentation, you want a letter for your client. We do it at NJRC, and Valley close your ears. But we get documentation literally all the time. We put it in Salesforce. And a clear explanation on what supporting documentation County Board of Social Services. Frank Mazza is here. Frank is professional. He's buttoned up. Candidly, some counties have been rougher than others in terms of what documentation to like that. And we're like, all right, this person is accepted in this county, not this county. You have to know what the county accepts. So one, connected to the healthcare provider. This Med form is so important, and not everybody's going to be able to access. Some insurance programs will only give you a physical once or twice a year. So in advance, you need to tell the person you need that med form completed. Obviously, the compliance letter from IOB and documentation. Thank you. All in the house. Try to hit the second before they come. We're going to ask Madison a couple of questions.
Hi, so we're going to talk about the incorporation, which is referred to by chance. to read an article about you. All lady has one. So I hold this job pretty much by promise. So I take it very seriously. Fortunately, after that's been explained, now, folks in the population, we sort of very familiar with the phrase, you know, it's what you can prove. You would think incarceration is something that you just need to find a big companies. Oh, and you want to jail, no, that's not the case. Fortunately, to get this exemption, which is it's a 90-day period, and it basically starts at the end of the month. That's on the on the Friday, you get to end up the. But all you need to prove is documentation from the police, which isn't as easy as you would think. When I was released for the incarceration, I think the first thing I did was on myself. Right? I explanation meeting because I didn't know what the meeting was. I'm still surprised that he made it to the door. But it's not true. Unfortunately, some people that the legal services team already done this. Everybody. Legal services document court search. We also do an incarceration history search. And the reason we do that is because we can use people's jail times to get rid of fines and warrants. But now we're actually going to be able to use a DOC printout or an Essex County jail printout or a Bergen County jail printout. Any printout that reliably shows the facility from which the person was released and the date of that release to prove that they were incarcerated. Honestly, our job is comparatively easy.
I just jump into what David's saying is so critically important, and David is the senior director of legal services, and I can't thank him extraordinary. But what David says is important. The federal government isn't going to find out or demonstrate or document that you were in prison. That burden is on you, right? So again, we just got to reorient ourselves. If we don't read documents in the history of our lives, our clients, the people we're privileged to serve, are going to be whacked. So part of what David is saying, NJRC will document that because of our relationships and our documentation. But that's why I would just respectfully encourage you, if you have someone you know, somebody who's heard to NJRC, board, Plaza, and to be separate in county by county by county. The point here is the documentation burden is on the individual. And if they don't have documentation, what happens?
What about you now?
Yeah. So you have the 90 days, but the need is to provide documentation that you have just left prison and or treatment, addiction treatment and non-addiction.
Yeah. Well, I mean, so, as Scott really pointed out, if you personally are building your own life after incarceration, or if you're helping somebody who is, take every effort you can, use reckless standing as possible to collect, maintain, and store any documentation that shows that they were commissary receipts, release paperwork, property receipts, anything, because that could very easily give that individual 120 days full of it they have left to get their life together. Now, just to put in perspective, when I was released in California, I was in transitional housing for 90 days. 90 days. And even when I was released in housing for 3 years, I didn't have a home. So 90 days can go by real fast. So let's see what guys just like to advantage.
So now we're going to go through what David wanted to discuss. David and Madison, if you would, everybody go to page 6. Page 6. So page 6 focuses upon what Madison and Damon just did far better than I think presented elsewhere. The Jersey family Medicaid exemptions and inclusion, exclusions, pregnant women, medically frail persons, people participating in the drug or alcohol program. This is important. Veterans with a disability rated is 100%. So if you're 90% disabled, you still have this work requirement. Parents or guardians of caretakers, family caregivers of a child 13 or younger, or of a disabled individual. Former foster youth under the age of 26, American Indians, American Alaska Natives, people already receiving meeting SNAP or TANF work requirements. David just referred to this. People who are incarcerated, people released from incarceration within the prior 3 months. But on page 6, you read this, but what Damon said is, you have to demonstrate it. You have to demonstrate it again on the medical side, you have to demonstrate it on the behavioral side, you have to demonstrate it on the incarceration side. Medicare enrollees under 19 or over 64, and short-term hardships, that's based on the state recommendation. All right, so that's it for Medicaid, SNAP, under 18 or 65 or older, medically certified, pregnant, disability benefits, children of the age of 14, drug or alcohol, already working 30 hours a week. So these are the exemptions. Next page, page 7. These are, and if you have any questions for Madison, the 5 statutory categories of medical frailty. Individuals who are blind and disabled, individuals with substance use disorders, but again, treatment, individuals suffering from disabling mental disorders, individuals with physical, intellectual, developmental disability, or persons with a serious or complex medical condition. And then you see a further explanation for those benefits. And you'll see on the back. If you go to page 8, and I just want you to see this. About cancer. Now, right? This is what CMS said. Remember what I just referred to, and I'm going to ask Madison one last question and see if anybody has a question for Madison. But cancer, end-stage renal disease, HIV/AIDS, significant heart disease, multiple sclerosis, Parkinson's disease, generally not eligible for exemption. Diabetes, asthma, hypertension, ADHD, obesity, anemia, unless documentation establishes severity or functional impairment, right? So there's a distinction. Not all medical conditions qualify or that CMS is predisposed to grant. And then you will see addiction and recovery that Madison referred to. Again, active participation in the license treatment program is itself an exemption. My dear friend Robert Parkinson is here. You have to have documentation from a licensed program. It doesn't mean that you're in a recovery outfit. It's a licensed treatment program. Beyond active treatment, substance use disorder generally qualifies as medical frailty under Medicaid, but it's subject to the same Part 2 test. And individuals in a sustained recovery of 5 or more years may face individualized review. Ironically, if you're long-term sober, you're actually jeopardized, but I'm not, whatever. Last paragraph there is important, and Frank Mods is going to talk about this. And again, self-attestation window is closing. What does self-attestation mean? That means me, myself, and I say, I'm exempt, right? It's closing. Where the state cannot verify medical frailty through claims or data. A client may self-declare, but only through January of 28. So after January 28, no more self-attestation. All right? And I just want you to be aware of that. After that, clinical documentation control. So again, I just want you to be aware of self-attestation. Does anybody have any questions for Madison and or David? Sure. And can you give your name? I'm sorry, and I'll give you. feel like, what? Yeah, exactly. Thank you, I apologize. Could you mind giving me your name?
Thank you. My name is Jose Caro. I'm here from the Visiting Nurses Association. Thank you very much, Governor. So my question is, there's a lot of focus on licensed treatment programs, IOPs, but there are a lot of folks in the state of New Jersey that receive substance use disorder treatment outside of like an opioid treatment program setting, such as a harm reduction center or buprenorphine medication in an office-based setting that's not a licensed treatment program, but it's providing substance use disorder treatment. Do we need to be just focusing on the diagnosis piece for their exemption? Like, should we be concerned about what burden the program needs to be in order for their active participation to qualify for exemption?
Yeah.
Great question.
Yeah, great question. I think definitely the diagnosis piece and then any type of verification documentation of, that they're getting treatment, any type of work they're providing, be provided so that can be shown, the number of hours and things that they're doing.
So, Matt, so would that qualify?
So it would need to have like the diagnosis piece. So
So you would lean into the diagnosis as opposed to the license. Great question. You hand the mic to the troublemaker in front of you.
Hi, I'm Phyllis Taylor, Director of Community Transformation. Question, the different age for Medicaid for years old and for SNAP is a 14-year-old child. Is that correct? That is different ages? In other words, Medicaid is under 15 and for SNAP is under 14.
Yes. Those are, and it's also inconsistent between what constitutes a dependent child. There are a couple of, you want to touch on that? Well, wait, this is a big show.
No, I just want to say that is accurate, even though these rules of the federal government, as the governor stated, so the rules go exactly wrong, which as stated, there are additional challenges in terms of ensuring that individual health security.
So again, and just to pick up on what Commissioner Milky said, they're also different departments. Department of Agriculture, Department of Human Services, entirely different, but they're both thrown into HR1. A question in the back? Oh my God. Can you just pass my book to the guy? All right, great. But this way we can take it, we can get it for people who are watching from home. Thank you so much. We love legal services. Thank you.
First of all, this we're talking about does that apply to
I'm here.
okay?
Yeah.
I love that. Fantastic.
Yeah.
I think with Laura,
Yeah. Yes.
And so saying, the biggest hospital nearby has all these medical records.
Yeah.
So, because we're stated, so these are things that, the states, countries, right? There were additional, interim rules that were issued this past, June 1st. And states are trying to figure out, based on that, what is going to be
think there's a line in the SNAP and SNAP eligibility of Medicaid and Medicaid. So, I think
To go to the commissioner's point, that was a great question. So what we're doing at NJRC, we're doing the most, if you will, the most onerous, the most difficult documentation we're doing, and we're putting it to Salesforce. And then we're using that for both SNAP and for Medicaid. But the way it gets tricky is like my dear friend Phil is saying, particularly on children that are dependent children, and when you have the question of a caretaker, there's also this issue. And then we got my back. Thanks.
Hi, Maria Fenner. I'm the Senate coordinator for the Council School District. We're proposing that SEMI is special education Medicaid initiative. So my question to you is, what can I do in school district setting to help the community in avoiding, because they have to be Medicaid. So if they lose those benefits, how do coordinators in the school district help parents of these children be able to not be there?
Sure. Great. Well, I mean, we're more than willing in NJRC to partner with you and coordinate efforts to the Dr. Patterson and Reverend at a church in Patterson. So we'll be glad to go out there. I mean, we're doing this in other counties. We're working with jails. We try to work with the Board of Social Services. That's so important because having Frank Mazza here is critically important. So when we send a letter, when Gwen Waterman sends a letter that we're communicating. So we always try to do it in tandem with the local county government. With the separate local platform.
I also want to highlight that these new rules only pertain to 40% of the community. Children up to the 75, the eligibility rule, next. So really, as you mentioned, 40% of the individuals who are eligible for Medicaid through the Affordable Care. That's such an important piece. We have over 1 million people on Medicaid, and this applies to
What's important, as the commissioner said, what's important is though you have a population that we love to talk to because they're going to have friends and family in this population. So like for the work we do, what Josie does and Reentry does, they're going to have a son who's 19, who, you know, is maybe whether it's a treatment program or a veteran or whomever. We want to make sure we touch that population, so we love to partner with them. The part of this is so many people, and I think somebody said, I think Jenny said it earlier, that people like never get the letter. They never get the letter. They move, they never get the letter. And they know that all of a sudden there's no food stamps. All of a sudden there's not going to be any health insurance. And the way they can find that out is when they're in the emergency room. And that's going to be a disaster. Because then all of a sudden they're miraculously discharged within 4 hours. Yes. Yeah. Exactly. Robert? All right, well, I think you can get the general right there, I'm sorry, and then Robert, and then we're going to move on to the next panel. Thank you. Thank you so much for that question. Oh, we love Atlantic Health. Where are you based at?
In Morristown.
Okay.
The question that I have, many of our patients who are often relying on these programs have difficulties, and are there explicit permissions for us to conduct these evaluations, be it telehealth encounters, where we have to see them physically in person, this would be that big hardship. And then do we need to see them every 6 months, even for a condition that has been for many years?
Yeah, what I understand, Doc, and thank you very much, and we're really grateful. What we're doing is internally with NJRC, we're doing telehealth, and we're doing attestation from physicians through telehealth until we hear otherwise. And as long as Commissioner Commissioner shakes her head, yes, I'm going for it. But I mean, but to the Commissioner's point though is the regs have changed and changed and changed. Originally, there was self-attestation. Originally, that I could do it. And that was being discussed and being proposed on. And then that was pulled back and it required after 28 clinical documentation. So we're doing it. Last question is Robert. And sure, Robert's right there. Oh,
I have a question for you.
all right. You've got the mic, so.
Thanks. My name is Dana Charleston. I represent the reentry coordinators for the county jail state. And my question is for our reentering individuals, how do we get them Med 1 form so that we can get them processed prior to their release from incarceration?
Matt and Ruvel.
So right now, to my knowledge, the only way to access it is via SNAP application. It's in there to download. But as far as getting it provider, I don't know if it's within that they want an application. That
Would it be beneficial for us to contact the
yeah, absolutely.
Yeah, definitely.
That would be a game changer for our reentry client.
Yep, thank you. Yeah, no, I would definitely get the Med from the Board of Social Services. Great. Robert, and then this young lady right here, and then we got to move on.
I'll let you first.
Okay. Right. Can you give her a mic? Thank you so much. Great question, by the way.
Good morning,
And by the way, yeah, a lot of the physicians, sorry, a lot of the physicians that we work with already have that form. So just to be aware of that, physicians that typically accept Medicaid have the form.
Good morning, Roxanne Long. With regards to individuals that are breaking into society from incarceration, the restrictions and everything being so tough. Are funds being diverted to nonprofits that are fit with work readiness? And the reason why I'm asking is I'm in the process of opening a nonprofit that's going to assist with work readiness as well as job placement.
No,
So that's going to be important to me.
yeah, no. So there's no federal change. Zero. The federal administration has reached out aggressively. I want to thank Dr. Shaw. I want to thank Valerie in terms of grants. But the problem is, and I think somebody said it earlier, by the way, Reverend, thank you, we mentioned that Reverend Slayton is also so make sure we hook up with Reverend Slayton for Patterson. But no, there's no federal, none whatsoever. So when Gabby was talking earlier about the 80 hours, we're creating this mechanism ourselves with an NJRC, and I'm going to say thank you to Secretary Coughlin, the Senate President, the already, that's really an they have to like walk the walk with us to make sure that we're provided, but we're cobbling together the 80 hours to do that. So the answer is no. But again, it has to be a certified program. So everything we do is on the CPL training. It's so critically important. So there are no questions. Thank you. All right, so we're just going to move on to the next panel. Thank you. Can we run a poll from Madison? And Iris, hey. Iris is the board president, director of sustainability and urban expansion. The great Frank Mazza, the director of Hudson County Department of Family Services. Gabriella, and deputy commissioner, my dear friend. So this is the heart of it, right? So what we talked about was what is HR1, why it matters. We heard from Jenny Payne, we heard from Sharon, we heard from Liz, we heard from the team. We talked about exemptions. Again, Madison went through a very detailed presentation. please feel free. The NJRC website. Damon talked about the 90 days prison. But Damon Finnegan emphasized you have to be documented. I can't say that I went to prison and put it on CMS document. I have to provide the documentation myself. And now we're talking about understanding SNAP and Medicaid. And so I'm just gonna ask Frank Mazza, and Frank is Director of Hudson County Board, Federal Housing and Corporate Family Services, but he's been in the reentry space and he told me everything I know or don't know. No, I can't blame you for what I don't know. I do blame you for what I know. Frank, can you talk about the challenges of documentation and what each of the counties are doing?
Yeah, so I want to give it, what we've heard so far is can everybody hear me?
Yeah.
Good morning. So what I want to talk about is, we're hearing about what sort of the community advocate can do, what the nonprofit world can do, what is required of the client when it comes to documentation. I want to give the perspective of the welfare agency over here because
So, you're gonna think, who are our friends? And in this battle, it's the whole thing. We've got to divide in this space to make sure that people have food and people have healthcare. So we have to divide in this space. And it's so critically important that you have a relationship with the board, with the county board. Like for us, we got to do much, but if you're in one county, that county board has to be your new best friend.
so a common theme is it's documentation, and that the threshold for that documentation has increased. Okay, from the welfare point of view, and I'm going to use SNAP to articulate this. Prior to HR1, the feds paid 100% of the SNAP back, which they still will do now, provided the local welfare workers meet certain requirements. If there is a error rate and allowable error rate of 6%, that error rate relates in large part to documentation, pre-documentation that substantiates an application and justifies the release of benefits. Prior to HR1, if we were above that error rate, we have to provide corrective action. Huge portion to be above the error rate. And there are error rates on the left hand side. For example, it's a bit more complicated on that one. I just want to use that straightforward. So, if a county or that state, the state has an error rate above 6%, punitive.
And it's so crazy, like, I didn't believe it. So, and this is why I feel like I'm talking to my family. You've got to understand this. He's talking about an error rate, right?
Well, let's talk about an error rate.
So an error rate is like, I'm sorry. An error rate is like when you make a mistake. But when you make a mistake means that you're trying to give somebody like healthcare and that documentation is wrong. Like you could be doing God's work and trying to, God willing, to give somebody healthcare and you make a mistake on the documentation. You're not going to, you may go to heaven for that documentation error, but CMS is going to say that's an error. So you need to be aware of what constitutes an error rate. I promise Frank will show.
So if we are above the error rate of 6%, at the start I said the federal government pays 100% of the food stamp benefit. If the error rate goes above 6%, on the low end, the state and the county will be responsible for paying 5% of that benefit, on the high end, 15% of that benefit. I don't like when people say 5 and 15% because they're small numbers. 5 and 15% are calculated against in Hudson County, $20 million a month that goes out in food stamp benefits, and at a state level, $160 million a month that goes out in benefits. That penalty is going to be too much for a local government's budget to bear. So you have a situation where If you issue the benefits in error, you could face this penalty. If you don't issue the benefits in error, in a general sense, it's a complicated thing, but in a very general sense, if you have everything you need or hesitant to issue it because you're questioning yourself as an agency, you will not get an error. So it is in the best interest of the agency to be cautious when issuing benefits. So now you have a welfare agency that has a very high threshold on what is required with documentation and will be hurt fiscally to the point where it's going to be difficult to operate welfare in the county if we are releasing benefits inappropriately. So getting that paperwork together, making sure it is appropriate, and having somebody that can speak to the local social service agency about exactly why it is appropriate is of the greatest importance, because you're going to have a hesitant welfare agency that's going to be reluctant to issue benefits, and it's going to go through things like on the Medicaid side, we're going to see more work. Predeterminations are going to increase for certain populations. So the welfare workers are going to be overburdened with the amount of work that's coming, and they're going to be tasked with being very particular as they judge these documents that come in. So it is important that people understand the perspective of the welfare. They're not trying to be punitive. They're trying to protect candidly the taxpayer from bearing the burden. The last thing I will say is, baked into HR 1 is a $71 billion increase just the admin costs get pushed back on the city. This year, our government will have $1 million in the budget and make sure that people, that is baked into the bill, additional costs of $70 million. From there, the local welfare agencies, their responsibility for compliance and the taxpayer is to make sure that $1 million paying 5% of that.
He took our papers. He didn't let us.
I didn't know that. Okay. Yeah, I got. So somebody lives in Kearney, New Jersey, and they're on Medicaid. How do they get kicked off, and how do you interact with that person and or the nonprofit?
Oh, wait, the numbers are right there. Right, because now they're going back and you're trying to figure out how to bring those that because you didn't write, let's say.
Because there's certain populations that are just going to be removed, they can't get back on. Other people have to be removed because they're not complying with employment and training regulations. Other folks can't get back. Too many welfare agencies that should be cautious. I'll hand it over to Valerie, but quickly I would say my federal Department of Labor grant, pays for employment and training, calls for 150 of its clients that money that we have, pay for 150 of their clients to pay for employment and training. That's not the money. Right. You know what I'm saying? I mean,
So 151 in the grant, and how many? 2,000 were removed, right? So I think Frank just said something very candid, and very honest. There's no benefit. There's no benefit for giving someone Medicaid or SNAP from the county perspective, but there is a burden and detriment and potential financial consequence. Not assessing the county doing what they think best, but understanding the burden of documentation and why this is so critically important. Like, my dear friend Valerie, like, why would you show up to this meeting? But anyway, go ahead, Matt. Speak real quick.
Sure, for a couple of things. So one is, I made a mistake in terms of data earlier. We have over 2 and 550,000 eligible under. Secondly, at the end of this, I'll give you an email address to folks, so that you have, so you can sign up to receive updates as you receive. So I have your pencils and candy, supplementary, I'll give it to you now, and I'll give it to you at the end of this as well.
So we have a stakeholder, email. That's M as in Mary,
Yeah.
A as in Apple. S as in Sam, dot, federal changes, FEDERALCHANGES, at NJ.DHS. I'll do that at the end as well. You send in your email address to this stakeholder email. That's information is coming to us. We will send out information to the stakeholders. But in terms of eligibility for Medicaid, since HR 1, I think it's beautiful. Since HR 1 was enacted last July, even before that, we have been working hard to be able to determine individuals eligible for Medicaid without even having to get that. Without even having to all the data so that individuals continuously have access to Medicaid. For example, as you was mentioned earlier, individuals who have children under the age of 30. So if that individual is caring for in their house, has Medicaid, more data stream, which we don't imagine. Valerie, you have to. She's not. You're not gonna. All you need is that. I was also shared you have so
One of those one thing. That always different purpose, not in the fuck. There's more fine characters and stuff.
what happens past a lot things have changed a little.
I had to go through that myself.
And what happened was we heard earlier discussions for medicine around stage 4 cancer. And the people that identified is that the diagnosis of the place, that would have been sufficient. And that person would then not have had to submit the additional documentation to demonstrate that. June 1st, unbeknownst to any of the states, was that that person still needs to demonstrate that they are unable to work. And so New Jersey has joined in with a number of other states to file suit to state that, you know, this is our understanding when the bill was enacted, and that minimally that this requirement should no longer should not be imposed. But secondarily, if it's identified that it's being imposed, the states have a lot more time their system. They could have to demonstrate that doing a lot here in the state where 10 years ago, we were able to determine 15% of the individuals eligible for Medicaid without having to June first.
You gotta get the good stuff while it's still here. Bagels, you don't get that stuff daily. You can. Hey, yes, you do. When you do the apprentice, you get to go get everybody's food.
Before we back from, I think about it. Don't they have to demonstrate and going back and then someone who's 14 years old, won't they have to demonstrate that person is indeed 12 years old? The residency piece?
Yes, yes, so that,
Not in the ordinary course, but if you're being released from prison and you're going back and now you're going to be taken to the trial.
I
Well,
would, yeah, so those are the things that, and it may not be, ready at that point, January first. So all of this, 2027, all of this goes into effect. We're continuing to look this way. And so like Medicaid, down here. You have Medicaid for your. Spending, right? So this is why I think the community. Initially.
and so I just want to thank the commission, thank Valerie, because what you see is this is evolved. Right? Nobody thought that they were going to require attestation after 28. No one thought that it was going to require attestation from the physician. But this is changing on a regular basis. So the email that Assistant Commissioner gave is really powerful because part of this is in real time. So I just encourage you to access. And again, I want to thank the Commissioner. I want to thank you for the job and the governor's office. But before, and I'm going to call on Iris next, but I just want to ask Frank Mazza. So if you're in a nonprofit, if you're in 100 counties, what should you do if you have your own nonprofit? What kind of outreach? So like everybody has different populations, right? Our population happens to be largely those folks that are court involved, but you're going to have an addicted population and the rules are different. What should an individual, if Robert Parkinson's in Patterson, if someone's in Passaic, if someone's in, God forbid, Sussex, or joking. What should they do on a county by county basis?
They shouldn't get the welfare agency, they should educate themselves on what is needed. Maybe ask the welfare agency if they consider any training, and learn what documentation is required and how the welfare agency. And more important, just have a dialogue, somebody they can speak to at the welfare agency, if they're difficult to get in touch with. We have 60,000 Medicaid cases, 53,000 SNAP cases.
Wait, say that again.
Point of contact.
Say that again. How many?
We have about 60,000 Medicaid cases. We have 53,000 SNAP cases, which is about 94 individuals, 94,000 individuals receiving SNAP. So get a point of contact where it's easy to reach out to that very agency and go to the correct line of communication.
Thank you. Iris, as a community provider, what are you doing to prepare yourself for this challenge?
Hi, good morning, everyone. Iris Wilbur-Speaking. My current role is resident now. Specifically for the Medicaid eligible population. Currently, Association of Jersey, we partner with local municipal county and state level agencies providing any type of services to the community, and we come together specifically to educate ourselves around any pertinent information to vulnerable populations that we serve. So our role is one, get informed, go to the website, our state website, and update the changes and the regulatory requirements because they are evolving on a regular basis. And again, we're talking about security, we're talking about people that we serve. Many of the agencies do not have a subject matter expert, but we can lean on each other to ensure that we're providing current information and connecting families to the right processes, because the administrative burden not only lies on the individual Medicaid person, but agencies servicing families from the state. So again, know where to go, look at the website, become familiar, and know how to walk people through, because it is burdensome, it is exhausting, and you have to do this from once a year to twice every 6 months. So generally, people will have to, I already reviewed, I already did paperwork, I'm going to do it, and it's not going to be this way in January. Right, so again, we need to lean on each other and break down these silos to ensure that agencies are educating and getting training and know where to go, right? And we don't know everything, but I'm going to lead our partners to ensure that I'm getting correct information. Yeah.
All right, great advice. And I just want to pick up, you heard earlier, and I love Assistant Commissioner, but you heard her correct herself and say this was wrong. I love her candor, I love her truthfulness, I love her accountability. This is changing regularly. So it's not a matter, there's no, let me speak to myself, there's no expert here. It's understanding, and as Iris said, and as Valerie said, go to the website again and again and again, and understanding, like, I was stunned by the attestation. Like, I was like on the phone with the Assistant Commissioner and said, oh, this, and then all of a sudden, that's what people thought was coming out of CNN. And then, like, 3 weeks later, it was something different, and I was done. And so you just have to be used to making these changes. And so when we just talk about the 80 hours just briefly, how can people find information about the 80 hours?
So the 80 hours are in the over SNAP, able-bodied adult without dependents. It could be any combination of 80 hours a month between paid work, unpaid or volunteer work. And then the Medicaid community engagement, the same, but this is for 80 hours. It counts for 6 months, and SNAP, you have to qualify every month, the 80 hours. So the qualifications differ.
So Frank, so what are you doing on a county level to work with nonprofit agencies on the compliance requirements?
So right now, we have contracts with some training vendors. Unfortunately, that contract is funding the base. Yeah. So after that, we're planning to, the state is giving us skill of Jersey Reentry Corporation and that can provide training. We get work here.
What we call it?
Don't put that in point. So remember, relationship with your board of services, relationships with your director, but understand that this commitment, this requirement is ongoing. I just wanted to see if anybody had any questions for Gabrielle or also for Iris, the assistant commissioner, and for Frank Murphy. Robert? I'll walk back.
Hi, I'm Robert Hawkins, CEO of Jersey Reentry Corporation for residential substance abuse. That's not all the questions. I'm not going to answer directly. The most specific one, we get people from all over the state. We can treat people looking for continuing 3, 6, 9, 12 months, which stands over non-compliance and associated with reserving and visiting. I have a practical question. I have folks come to us, it's always a challenge to try to figure out what they want medically. We rely on Medicaid, 95% of patients pay for Medicaid. And that makes a lot more slavery, challenges that we face. People serve should make the unsure. How do we know when they don't get out of the way? Because they, you know, we rely heavily on also, it's appropriate. So, thank you.
Right, you want to take that or Commissioner Bath? Right here.
So at this point in time.
Yeah, the book.
One of the things that we don't do is available. A lot of modifications that we need to make to our system. In order to apply to what the HR one.
It's 6:20.
Is from there to the. Saying, yeah, we're gonna be ready January 1st. There are other things that we need to modify, but we are working towards. We are also working towards more individuals being able to notice messages, communications to mail, messages and the like, so that they know when they're application.
So I just want to say thank you to this Assistant Commissioner, and thank you to Commissioner Shaw, because what Robert said, turning point, it's really difficult, right? We get people from all over the state. New Jersey Reentry, I mean, we have people, we have different centers, but, you know, Josie goes behind the wall, whether it's Essex and Monmouth and different county jails, and so it's working, but that kind of centralized information source. But again, you're doing that when Frank gave those numbers for Hudson, you understand the enormity of the challenge of documentation. Frank, did you want to comment on Robert question?
No, other than to say, the state website, like Valerie has started the best live search on any government website where you can go and put your information in, and it will tell you how many picture for every treatment provider to start having.
Yes, I'm going to let you know. Me, I'm going to use it.
Hi, Tracy. From the Bermuda, and President Commissioner, see this afternoon, Dr. Shaw. So I have two questions basically. So for us, we see would there be a possibility for each of those companies to get from one pager in terms of what documentation that they would accept? Have a link behind the team their applications for all applications? That would be extremely helpful. And I'm doing things like working on his team to try and make relationships, you know, easier between the county. We have State County. Against like this, because there's a lot of stuff that these managers need to hear. I heard today, and I'll bring back, I think they all need to improve because a lot of this is so much gotcha stuff, and I feel like it's just set up to trick us all, which is the exact opposite of all of the things when you got it in the first place. So,
Well, by the way, guys, you got to follow that. You get close to the answer. Why do you look outside the home?
And to, you know,
They really have. And I give them a lot. One of the things that, one of the things that I want to highlight is that, as we all know, these changes are being double government through the internal. What's going to happen, though, is that individuals are going to go they're going to find that what the cost of the things change. We're going to get frustrated with it. For whom this is not the doing. Right? And I just want to say that really quickly because we are working quite hard to say when you say that we vote on that, they're going to be a face saying, no. We need to go back. It's not good at pace of implementing what is going on. And I just really want to give it a lot of credit and just know that we don't on that sheet. On top of that, one thing that is that for this 30% of the population, they're doing double work. So the resources for that operation. If you want to put that out there. But I think that your point no, I just want to.
We'll set it up and we'll invite you and Dr. John. But, and you'll eat a lot better. You know, I said to, I talked to Jada, I said, Jada, can you get these croissants on sale? Like if you buy them after like 6 o'clock, they're hot, like, you know, whatever. But no, we'll do that. We'll do that and we'll follow up and have Frank there and Iris and we'll invite the entire team. Thank you. We have time for a couple questions and then we've got to get to the documentation compliance.
Hi, everyone. My name is well. So to Tracy's point, when she was talking about very important. One of the things that we're doing is a community health council. We're getting up we have a local organization that are part of this community health council, and one of the tangible outcomes in also is the so a lot of these organizations are saying we want to understand what the changes are so we can communicate with clients. And so one of the things we're doing is health coalition also doing education on each one and every topic. And so they've been doing a presentation with organizations, and they'll also be doing that training in August. And so I'm happy to share that information with you to, you know, heading out to your network. So
thank you. Thank you very much. And we love the water. Thank you. But thank you. It's about making sure getting that information out, networking. Questions for Commissioner for Frank in the back? Okay. I'm just going to get her and then I'll come back. And go ahead. Thank you.
Millie Manos, Director of Medicaid Product at Horizon Blue Cross. This question is for Iris. Iris, the next major milestone in HR1 that we have zeros that are preparing for now is the non-citizens enrollment, which we haven't had a huge chance to touch on today. I was hoping you could inform the group of some of our next steps.
So thanks for that question. Again, this climate is evolving, and we do know that for October 1st, the non-citizen eligibility is going to impact certain groups that were previously eligible and now will no longer be eligible. So as of October 1st, for non-citizens who may not continue to qualify, may include refugees, asylum, humanitarian parolees, and victims of domestic violence and human trafficking. Again, it is important that as agencies that service the larger community, that we are able to identify who these folks are and bring them back to ensure that they utilize the tools, like in the state where they can check if they are deemed ineligible, right? And walk them through alternative processes, right? So again, ensure that they renew or recertify their eligibility, and if they don't qualify, we need to connect them to services to help further support them, right? Because it doesn't go away, their burden. So again, October 1st, that's the non-citizen clause. And again, there are in the website, on the state website, there's two distinct columns that speak to this. But again, knowing and being familiar where that this information can be identified, and then sharing it, right, to help identify folks that may fall under this purview.
Great. And now we're just going to ask if Tatiana can come up quickly, and Brian can come up quickly, and then we're just going to wrap up with just talking about compliance. And also, I'm really honored, Randy Warren, the greatest deputy sheriff of Hudson County, is here. So, Tatiana, what are you doing in terms of compliance, and how are we making sure at NJRC and Salesforce that we have compliance?
Yeah, so with our Salesforce platform, everything that we do here is documented. We have over 660 fields that we're documenting when it comes to if we're applying for SNAP, were they declined for some reason, are they receiving a termination notice? And this is all allowing us to generate real-time reports that are going to our case managers, our intake coordinators, Brian, director of HR1, and it's letting them know we need to follow up. Everything needs to be followed up. We can't leave people at risk of losing food. So everything in Salesforce, documentation, real-time reporting, and making sure that everyone is receiving follow-up. Social services is being contacted. Our clients are letting us know what's their current status, have they been to social services, and everything in between.
So we're copying, like if Jim McGreevy gets knocked off a SNAP or Medicaid, we're copying the letter I received, but we're also sending out documentation to the county, and we're copying the documentation we send to the county.
Yes, so we have an actual letter being uploaded to individual client profiles, letting them know that they're coming through the NJRC program. The letter can also differ if their SNAP has been terminated already. A letter will be sent out by our facility directors saying it should be reinstated because they are in a workforce program. And of course, you know, we offer training here at the training center. Anything that they're doing within our program is documented hours for that 80 hours.
So all the documentation is put on Salesforce, so God forbid, you have to assume it. If CMS, and remember what Frank said earlier, what Director Moses said earlier, if you have that error rate of X percentage, you also have the possibility at some point in time of a CMS audit, et cetera. So it's all on Salesforce. All the documentation is on Salesforce. It's documenting the workforce hours, documenting the volunteer hours, compliance. So the burden is hopefully on us as the social service agency to document on behalf of the client, right? So, I mean, I think Assistant Commissioner was really clear. This does not apply to the entirety of the Medicaid population. As Assistant Commissioner said, it's those that are receiving Medicaid pursuant to the the Affordable Care Act. But the point is, those are largely, those are our clients. And so those are guys and gals that are now working, trying to be productive, doing what the world says and what is right getting employment, but they're not maintaining their documentation. They may not have a driver's license. And then when people are coming out of prison, as David said, we have to get them on Medicaid before they get thrown off Medicaid. But in any event, so it's documentation. And Brian, what are you doing in terms of HR one?
So, yeah, essential compliance risk, under HR1. So that, as you heard before, the chief compliance risk under HR1 is not people eligible to stop information. So we're working at the granular level, at the data that participants are coming in and they are immediately screened. But our sequencing is stabilization first. They're screened for benefits initially, and they are placed in the appropriate compliance pathway. There was an exemption there rather for documentation verification support. They are collecting and preserving documentation prior to support their exemption pathway. The person is subject to the work requirements of their HR1. We're driving them into our workforce readiness program, and we are documenting that at distant levels. We're talking about attendance records, we're talking about hourly, we're talking about that granular level, so that when we are required, we believe we may be, to provide that support, we can pull up.
So you see a combination between Salesforce documentation, what Brian said is HR1, making sure that this is happening all throughout NJRC, but you realize that I may work at job A, then work at job B. I may have training here and then training at the Reentry Training Center. George is doing electrical program. George, are you awake? He's awake. He's our trainer. I bust George. George is a great Marine, simplified. But basically what happens, you have multiple, right? So you have to create multiple paper trails. So documentation. Tatiana, in terms of what information you would share, what would you share with other nonprofits? What would you share with other social service agencies regarding documentation and compliance?
In terms of how they're using our platform, I think it's really from the bottom up, not the top down. You need to see exactly, how is it being presented to our offices at our site level. We can't pretend to just implement anything that's going to work. We don't know, we didn't know exactly what to expect, of course, and even, there's been times within the past few weeks, we're still adding something to our system. So it's evolving. I think the most important aspect, like I said, is really from the bottom up. We need to talk to the workers who are talking to these people as they're coming in, losing benefits, who have actual experience with the social services agencies. Are they waiting 3 weeks to hear back?
And it changes from county to county.
Exactly.
Can you talk a little bit more about that?
Yes. So, depending on the county, we have some counties we can hear back in a day, same day. Others, it could be weeks. And that's why it's so critical for documentation to have these reports that are being generated in real time to our employees. So they see, someone's been waiting 29 days. They haven't had, food for 29 days. So we know we need someone within that office to contact social services and say, what is the delay? What's going on? Why has this person not heard anything back?
And so what Tatiana, so lessons learned that we're going to share with everyone is respond in real time, careful documentation, and then just steadfast follow.
Yes, and just the ability to change direction at any point in time. Like I said, it's week to week for us. If I can receive a call, hey, we didn't even think of a way to document this. This is coming up now. So we have to go back and in real time update a system that we're documenting in real time for real people. So it can't be a guessing game. It has to be everyone's in constant communication. We're all willing to adapt. We're willing to look at the system and make a change and not think is this too much work? No, it doesn't matter.
So, Ryan, just lessons learned that you can share with everyone here that we've learned.
Yeah, thank you for the question. And, at the end, you're talking about precision and story. But I think at a base level, we've heard it, management is an issue. And I we need to pay attention and ask the questions, even as collecting demographic information. What's your name, date of birth, and address? And do you receive mail at that address?
So by the way, we're using NJRC sites for people's mail. If you're surf couching, if you're in a shelter, like, God bless, we love St. Lucy's, but it's tough. If you're in a shelter in Patterson, well, if you're in a shelter, we will provide people with a steady address. And again, I just want to say thank you to Reverend Boyer. I want to say thank you to Reverend Clayton. I want to say thank you to the ministerian for being so supportive. But we have guys like right now, in Josie, can tell you, people in different counties that don't have a steady address. And so we're trying to provide it.
And also communication for social services, communication with participants, covering multi-channel outreach, right? So that we're reaching out to people in real time and to our centers, to our organization.
Thank you, Brian. Does anybody have questions on compliance? Sure. I hope I follow this.
My question is information around things. I've been in everyone are not the budget from paying rent, service, partner, life insurance. And I've been in this program in NJRC 3 years. I was 10 years old. Where is the compassion? Where is the humanity of people like me? I didn't go out the country, but I served stateside 16 years. They don't even consider me a veteran. So how is this going to help me?
So I think if you're looking for compassion in HR, you're not going to find it. I think the sentiment that we've been talking about is that maybe the intention of this bill is to make it too difficult and too expensive to operate welfare. Just directly engaging with what you're asking, I think the Essex County Board of Social Services and see how it can assist.
We'll do that with Jenny Pena for this. But thank you. And I appreciate Frank's honesty, right? And I appreciate your honesty. And by the way, one of our greatest volunteers, but it's difficult, right? So we've got a program, and that was a great question sort of to bring us to bear, but this is real. This is an academic. And so when people are losing their Medicaid, and people on the Affordable Care Act, as the Assistant Commissioner said, this is a challenge. And Dr. Cha, Valerie doing everything they can. I appreciate what Frank said to hold on. So thank you. Any last questions? And then we're just going to call upon Reverend Boyer to, sure, in the back. I need my steps. No, you're good.
So my name is Rachel. I actually work in the Department of Corrections, so I'm on the pre-release side of all of this. What can we do? What can we tell these gentlemen? What can we tell them to start doing now when we're doing our discharge plans? We start 6 months before they leave. So it gives them a little bit of time, but what do we tell them? Like, they're not aware of this going on.
We're not aware. We just signed it, just so you know, because we just signed an MOU with the Department of Corrections with Victoria Pugh. And I just want to really thank her because you really get out on the limb and doing it. So we're going to try to establish a protocol and we've been back and forth. Next 3 hours, but we're doing that. And so we're trying to work. We also realize, as David said earlier, that a lot of folks that are in prison don't have ID. They magically, sometimes more so sometimes in county jails, they'll lose their ID or sometimes their documentation. So it's a challenge. So we're aware of the 90 days. But then again, is like, so, and I don't know if Frank wants to touch this or Beth, Commissioner, is that, people don't have their birth certificates, people don't have their social security card. People may have, now if they were on Medicaid, it's much easier to go back on Medicaid. But if they were never on Medicaid in this environment, it's a challenge. But we're working with DOC on that now. Frank, did you want to comment?
I think, what you mentioned is it's one point, is that really working to, having those partnerships with community providers to assist, to help to navigate these systems. I think that working with, county social service agencies as well, so that individuals know what is expected upon the return back home. And most importantly, it's just staying on top of things as they continue to evolve. What I'm telling you today may not be accurate. May not be accurate in December. And so it's constantly evolving, so you need to remain informed. And so being on that stakeholder email list, I think it's
a great step.
A great step. Also, if you want information regarding SNAP, you can go to njsnap.gov, and the Division of Family Development continues to update that information as things evolve. And for Medicaid, if you go to New Jersey Department of Human Services, Division of Medical Assistance and Health Services, we have an OBA page, OBBBA webpage, and Frank referenced that earlier, but that's where we're continuing to put information, current information up there.
So like Sharon goes into Raleigh State Prison, Eastern State Prison. So when you talk to the guys in terms of HR1, what do you tell them?
Yeah, so we talk to the guys, but we also talk to the social worker. So we're in contact with the social worker, and everything we find out, we share with them, and they're so happy for that. So just, coming here, making sure they have their discharge papers. We were just talking, what if they don't have their social security card, but have their social security number? Would that be okay for them to get the continued the services for SNAP?
I would work with your local social service. I think it's what they're going to accept.
Yeah. No, well, no, let me know about it. We have to get that. No, but I mean, but that's a great question. I think it'll depend, as Frank said, organic by county. Jones, what's your experience in the jails in terms of what you're seeing?
Hey everyone. So I am a director of institutional enrollment for Jersey Reentry. So my team goes into jails and treatment facilities. And yeah, I think that it's very unknown, right? People don't know what it's going to look like. And in general, most people don't have their ID at either of those spots. So yeah.
That was a real offer. All right.
Good morning, there. Lieutenant Chairman from Alliance at the Beverly Health Center.
Yes, we do.
Trying to find out in terms of compliance for volunteers. We don't have Salesforce. Would we put them in our payroll system? Do we have to go that far? Or is it a simple documentation or team shift?
We're walking into that right now. So I know I don't have the answer. Tatiana, do you have the answer?
I think after internal discussion, I may.
All right. So we're like, and what you have to understand is that you also always have to be underneath, you have to have you have to have documents. We're working on that very issue right now, and I don't have a thoughtful answer unless Frank or anybody else has an answer on the community.
Okay, so unless this changes because everything is changing at a whim, verification must be provided by either an employer, nonprofit, community organization on letterhead stating total monthly hours, and that is
again, the federal ruling, but this keeps changing, just like the self-attestation, but that is so far from this.
Yeah, but that's what we're doing, putting it all in Salesforce. If you don't have it in Salesforce, you have to, I think, assume the particular scenario that they're gonna need the documentation on the hours. And so it has to be resolved, you can't, like, Jim would bring me math question and like eighth grade and like, figure it out.
So right now it says, and I wanted to make sure that I didn't say anything incorrectly, so I can check, and right now it does say employment verification form will satisfy it. Yeah,
Yeah, that's what we're doing, but like, yeah, so what Frank said, it's the stationary, it's the attendance, but there's always the possibility that there may be hours, and so we're just cognizant of putting the hours. And then there's somebody in the back, you'll be your last two questions, and then we'll call on the lawyer. Thank you. Thanks so much for your kindness. Thank you.
Quick question, sir, in regards to the 80-hour requirement that NJRC is providing free, but of course, like motion capture, having that environment with NJRC and moving on to that. A lot of people are getting out, they want to want to social therapy, jail, and then prison. My jail is not provide. So in regard to that, for the program requirements, when you're thinking about how they're going to meet those work requirements, do not be the exemption for the people that want training opportunities and other people.
Thank you. So like the first thing is? First thing is? Jen, thank you so much. Yeah, so Jen says not everybody has access to a training facility, and Jen, you're right. So, in fact, I have a meeting with Monmouth County, and what we're trying to do is work with Brookdale, the community college, and the whole goal is with the community college, so that the community college provides for training, particularly digital literacy, intra-digital literacy, advanced digital literacy. Those hours will all count towards the hours of workforce training. And I've got my boss, but yeah, but that's what we're doing. So I'm meeting with, we've been in conversations with Brookdale. They're doing actually peer recovery for us right now. And we're going to be looking at expanding series of courses. Yeah. But they can still do it through the one stop. Yeah. Yeah. I agree with you 1,000%. You have to talk to me. I believe it on. Yeah. We provide transportation here, but I need so we're meeting with Cumberland, we're meeting with Atlantic, we're meeting with people all over the state. And so we're trying to get the county colleges, candidly. Been saying Dr. Aaron Fichtner has been a champion. We're trying to move with the county colleges to provide more opportunities for our population. But I and we've had really, to be fair, we've had really successful meetings. I mean, Hudson County College, they're on our wall and we love them, but the county colleges are moving into this space aggressively, for which I'm most grateful. And so, but more needs to be done, and you're entirely correct. We want to have the most robust all over the state. And again, I'm meeting with, in 2 weeks, with different county colleges throughout the state to see if they could be providing the training to qualify for something that individuals are interested in. Thank you. The last question. Oh,
hello, my name is Alexandra Moore. I'm a sexual violence prevention specialist. I want to make a comment and a question regarding the board. I know that today is meant to be informational as far as this person information about the HR1 and the update, but something that is also important to highlight is the potential gaps in service and resource connections for clients and their experience. It's very easy to tell somebody the Board of Social Services. However, if you've never been to the Board of Social Services, more likely than not, you won't receive the help. So I heard you say, organizations need partnerships with organizations services, but there also has to be this roundtable of client experiences when we are sending people coming home from jail to the Board of Social Services. They're not getting the resources that they are eligible for. And then you have policy in place that is designed to be even more difficult for them. It doesn't make people feel like their dignity is being respected when the services they're eligible for, they don't receive. So I think it's important to have a conversation with service providers. The way we service our clients, we may have to look a little different. We may have to go with our clients to the course. We may have to go with them to get birth certificates and social security card, because this is going to be difficult for everyone to navigate.
thank you. And I think that's very real, very honest what you said. It could be very difficult. Frank, did you want to comment on that at all?
No, just more than welcome to walk in our store if you have clients, have your clients in there. We have leadership and a constituent services office there, in addition to complaints.
But I also always said, because it's tough. Frank, how many people on Medicaid and health
About
insurance?
60,000 cases. We have about 300 to 400 people walking through our door every single day. So we have 638 staff members that are taking 94,000 individuals who are getting food stamps, 60,000 families that are getting Medicaid. So yeah, it's a struggle to provide the services. And as I said, they cost an additional $71 million for welfare at the labor force it is right now. So that labor force is not growing. So these additional responsibilities of the welfare office, they're going to have to be handled with the labor force that is designed to provide for what was there before HR1.
So, with that, again, all of this information is going to be on our website. If anybody has any information, and obviously we're trying the best we can, to work with the county colleges, to work with the Board of Social Services. I just want to say thank you, Brian. I want to thank you to Director Mazza. I want to say Valerie, to Iris, to Gabby, to Tatiana, to all of you. And now for benediction, if you can, please take an old croissant home. I'd like to call upon, we heard from the great Kenneth Clayton, and now we're going to hear from the great, our dear friend, who is our chaplain, Pastor Alan Boyd. Reverend?
Somebody wants to office information. Let us pray. Father, thank you for what you've heard. Thank you for this great organization. And after we leave this place, we'll never from your presence. Go and send us out wherever you go. We listen to Christ our Lord. Let the church say, Amen.
Amen. Amen. And I just want you to know that all information is going to be on our website. We'll continue to provide this information. Please take a minute of